Okay. Bismillah ar-Rahman Rahim. Assalatu wassalam ala Rasulullah. Assalamu alaikum, everybody, brothers and sisters. Welcome to the launch of the ISIP Ghana chapter. And thank you so much for joining us today. My name is Haji Aziza, and I'll be the moderator for this session. The title of today's session is Mental Health and Islamic Perspective. In order to deliver this lecture, we are very honored to have Dr. Niena Majeed with us today. Dr. Niena is a resident psychiatrist at Korle-Bu Teaching Hospital in Accra, Ghana. She holds a Bachelor of Science degree in Medical Sciences and a degree of Bachelor of Medicine and Bachelor of Surgery. She is involved in community outreach programs and her interest is in neuropsychiatry. Welcome, Dr. Niena.
Thank you very much, Hajia.
The floor is over to you. Thank you so much for joining us. So I'm giving you the floor. I'll just go on to mute now.
Okay, let me share my slides. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي أما بعد. Thank you very much, Hajia Aziza, for the introduction. As Islam requires of us, and as part of mental health awareness, ISIP chapter, Ghana chapter presents to you Mental Health, the Islamic Perspective. So for our talk today, we are going to go through what mental health is and the Islamic perspective. We are going to look at epidemiology. We are going to look at the factors that predispose individuals to getting mental health issues. We'll look at common symptoms in both adults and children. We'll look at where to seek for help and the treatments available. We look at the role of Islam in the management of psychiatric illness. We look at psychotherapy and preventions as mentioned in the Quran. And we look at what prevents people from seeking help. So I would say mental health is a state of wellness of the mind that enables you and I to cope with the stresses of life, realize our potentials, our abilities, what we can do, learn and work well, and contribute meaningfully to our community. So mental health affects how we think, how we feel, and behave in our daily life. And so anything that affects the way we think, feel, and behave will ultimately affect our mental health, such as the way we eat, maybe the way we sleep, our sexual activities, all that would be affected if our mental health is affected. Now, it's very important that we have good mental health, as if we want holistic good health, then that means we should have a good mental health. And this is important because it helps us make decisions. It helps us build relationship with individuals and help us shape the world that we live in. Now, if you have good mental health, you are able to develop yourself personally. Now, if you have that personal development, you can contribute meaningfully to your community. And this would ultimately lead to socio-economic development. Now, we have to also know that mental health, as I've mentioned, is not static and it changes daily in our daily lives or in our daily activities every day. So it's very important that we know what mental health is. Now, based on WHO's definition, what I just explained to us, and from the Islamic perspective, I'm defining mental health as a state of wellness, okay, a state of well-being with Allah, between you and Allah, and this is achieved through the guidance of his prophets and revealed books. As it has stated in the Quran, Allah has mentioned that Bismillahir Rahmanir Rahim, Alif Lam Mim, Zalikal Kitabu la rayba fi hudan lil muttaqin, that this is the book, the Quran, whereof there is no doubt, a guidance to those who are al-muttaqin. And also in Surah Al-Ahzab, Allah has said that there has certainly been from you in the messengers of Allah an excellent pattern for anyone whose hope is in Allah. The reason why I'm bringing all this is because as Muslims, we are guided by the principles of Islam, and it's a way of life for us. And so anything that affects our deen would inevitably affect the way we feel, the way we think, and the way we behave. And this would ultimately affect our mental health. Now, imagine you, a Muslim woman who wears a hijab. You go to work and you are forced to remove this hijab. You are forced not to pray your daily 5 times prayer. What would happen? This would affect your mental health as you are not able to do your work well. Remember that our way of life is based on this Deen al-Islam. And because of these restrictions, some people have decided not to venture into certain services as they may be prevented from practicing their deen, which, would affect this individual's ability to realize their potentials, probably because this is a field that this individual was good in, but things that if I go in there, I will not be able to practice my deen very well. So what happens? We lose these very important individuals with these skills, and this would ultimately affect the productivity of the country as a whole. Now, 1 in every 8 people worldwide have mental health issues, and 20% of the world's children and adolescents have a mental health condition. The reason why I brought this is so that we know that mental health does not affect only adults. It also affects children, and it's very important that we know what they are so that we can identify the issues as soon as possible and seek for help. Now, the burden of mental health in Ghana and Africa as whole has sharply risen in the last decade, and it's established or estimated that in the year 2021, about in Ghana, 30% of our population had mental illness. And out of this, 16,000 have severe cases. Now, this is to show that it's an issue in the country. And we shouldn't think that mental health problems is far away from you. Me, I can't get mental health problem. It's very close than you would think. And so it's very important for us to know what it is. Now, it's also been established that 71% of Ghanaians have psychological distress. And this costs the nation about 7% of the GDP. And this goes to reiterate the impact of mental health to the productivity of the country. Now, Ghana is one of the most religious countries in the world, and we associate most mental illness to supernatural causes. And so a lot of Ghanaians tend to seek help from traditional and faith-based healers And it's been suggested that 20 to 70% of individuals living in Ghana go to these traditional and faith-based healers as their first line of approach. Now, this is important so that we let people know that you can actually seek help elsewhere than just the traditional and the faith-based healing. There are other places you can go and you'd get the necessary help needed. Now, research done in the Western countries have shown that many Muslims are hesitant to seek help from mental health professionals. And I think that if the same research was to be done in Ghana, we would probably get the same results. And I think that is probably due to the fact that people lack the awareness of what psychiatric illnesses are and the symptoms. They cannot identify that this thing that this individual is going through is a mental health problem. And also, another thing that may be preventing people from seeking help is the fact that for we, the Muslim communities, people think that hospital management is un-Islamic. And so they probably would want to stay or go to our imams for help. But little do they know that the hospital management modalities that are used have integrated Islamic values in there. And so it's very important that when these individuals have mental health conditions, they can come in and they will get the necessary help needed. And it is not un-Islamic. The other factor that probably may prevent people and that would make Muslims hesitant to visit the mental health facility is ruqya. A lot of people resort to our faith-based healers and they go in for ruqya. One thing I've heard an imam say to individuals who are seeking or who are undergoing the ruqya treatment is that they should not seek for help anywhere, as if they do so, they would be belittling the powers of the Quran. And this is why I'm saying that people don't even know that coming to the hospital, there have been Islamic value integration in the hospital management that these individuals would get when they come to the hospital setting. Now, let's look at some of the factors that can predispose individuals to getting psychiatric illness. Now, the actual cause or the exact cause of mental illness is not known, but is thought to be as a result or combination of some of these risk factors that I'll be explaining to us soon. Now, looking at social, economic, political, environmental factors, some examples would be poverty as a major risk factors, as individuals who are poor do not have shelter and they don't get to eat balanced meal. They indulge in practices that are damaging to their health. Example, substance abuse. So it's more of like a vicious cycle. If you have poverty, you are at higher risk of getting a mental health issue. Now, individuals who find themselves in violence or in war areas, okay? So in violence, you are living in a house where your parents are always quarreling in front of you. There's beating of a partner, there's conflict everywhere, conflict in the community, there's war, there's gunshots here and there, people are running around. These individuals have higher risk of getting mental issues like post-traumatic stress disorder, anxiety disorder, depression, just to mention a few. Now, problems, some disease outbreaks can also predispose individuals to getting mental health issues. So, for instance, during the COVID period, we noticed that most of us were indoors. People could not go out to places that they loved to go. They were indoors, they couldn't visit family and friends. And during this period, research done showed that a lot of individuals developed some form of anxiety, depressive episodes. So disease outbreak can serve as a risk factor for individuals to develop some mental health issues. Now, it's been shown that there are some particular genes or mutations in genes that predispose individuals to mental health issue. And in a family, if there is someone who has a mental health problem, other family members have a higher risk of developing mental health problems as compared to a family who have no member who has a mental health issue. It's very important for us to note that. So if you are in a family and one member has mental health problems, you may have a higher probability of you getting a mental health problem as well. So you have to be careful and watch out for signs that we'll talk about later. Now, going to psychological factors that can predispose individuals to psychiatric problems, right from pregnancy. So pregnancy in itself is a physiological period and it comes with a lot of changes. So during this period, if the mother goes through a lot of stress, poor nutrition, emotional, physical stress, all this can go a long way to affect the mental health of not only the mother, but the unborn child as well, and could predispose this child to developing mental health issues in the future. So it's very important that our mothers who are pregnant, we give them the necessary support they need during this period. Now, early childhood experiences like harsh parenting, where these children do not have, they don't have a say in the family. They are always shouted at. They are not allowed to express themselves. They are always physical abuse here and there. We have a child who is being bullied most of the times at school. They tend to have this kind of inferiority complex. They develop other unusual ways of coping. All these can predispose this child to developing psychiatric problems in the future, as well as sexual abuses, neglect of children. Is very important that children growing up are not neglected, their needs are met. All these predispose these individuals to having mental health issues later in life. Now, to you and I, some unhealthy habits also predispose us to mental health issues, like not having enough rest, abusing drugs and alcohol, excessive gambling, just to mention a few, are some of the unhealthy habits that can predispose you and I to having mental health issue. Now, some stressful events like losing a loved one or becoming disabled as a result of a road traffic accident, all these can predispose individuals to getting mental health issues. And so if any family member or anybody loses a loved one or undergoes road traffic accidents, would need the necessary support and help from people close to them. And if we realize that they are not able to cope or they are having issues or some of the symptoms that I'll mention later, they need to seek for help as soon as possible. Now, some medical conditions also predispose individuals to having mental health condition. So our hypertension, our diabetes that are not being controlled, sometimes some brain tumors can let individuals act in a way that they were not acting before. And so the more reason why, if you see anything unusual about anybody, you may have to advocate that this person comes in for assessment as soon as possible. It could be a medical cause that is presenting with psychiatric symptoms. Now let's look at some of the common symptoms that we would see in individuals who have psychiatric problems. So if you notice that you have poor concentration, you are not able to concentrate on things, you are easily distracted. Maybe before that wasn't how you were. You could sit through 2 hours and do whatever you want to do. Now, even 30 minutes or even 20 minutes, you are not able to concentrate. You are easily distracted. You realize that, or if you find out that you are not able to remember things easily like you used to do before, or you have this unusual thoughts, you have this recurrent thoughts, you have this thought of harming yourself or wanting to kill yourself or kill somebody else, it's very important that you seek for help as soon as possible. If you notice that somebody who is close to you starts talking unusually, either the person is talking too much, or maybe you ask the person a question and the person is not answering you, is talking about something different, or somebody is speaking, but you can't make the head or tail of what the person, you can't understand what the person is saying. All these be signs of mental health issue, and they need to seek for help as soon as possible. In Islam, we have waswas, shaitan whispers. Now, these individuals may also have recurrent, repetitive thoughts that may be so distressing that it can affect the way they do things, their daily activities, their work, or their social activities. Example, for we Muslims, if you find out that you always have the feeling, or you always have the thought of incomplete ablution, and you need to correct it always, you realize that you have to perform ablution several times, to the extent that it may even be affecting your prayers, to be affecting your daily life, you need to seek for help. If you also find out that you have this thought that anytime you go into the washroom, your dress is stained with urine or discharge, and so you almost have to change the dress that you wear before going to pray, almost always. If it happens once or twice, that's okay. We all sometimes experience that, but with these individuals, they normally have recurrent and it's repetitive. They always almost have to change their clothing before they can actually go and pray. If you also have excessive forgetfulness in salat, every time you have to repay your salat several times at a sitting, you would pray like a lot of times before you actually finish your prayers, then there may be a problem. You have the continuous thought that I haven't done one rakat, or I didn't do my tahiyyah or anything of that, so I have to repay and repay and repay. You may need to come in for assessment. Now, if you notice that someone who was usually a happy person, all of a sudden is now sad most of the time, during the day, even during the night, is always sad, or somebody who just this is not how the person is before, easily gets angry for no apparent reason, or has become excessively happy for no apparent reason. So any dramatic or drastic changes in emotion, it's very important that these individuals seek for help. If you have this intense fear, or you are anxious about things, such that if people even open the door and bang them, you feel so anxious, you start feeling scared. And when this happens, you start having your heart beating very fast, difficulty in breathing, like a choking sensation. You feel this choking sensation, you start shaking, you need to seek for help as soon as possible. Now, if you have loss of initiative, if you're the type that you used to like doing things, you're motivated to do what you love, all of a sudden you lose interest in the things that bring you pleasure. You don't want to, you've lost initiative, you're not motivated to do anything. It's very important that you come in for an assessment. Also, individuals who you've noticed that they have this odd behavior where you see them laughing to themselves, or they are hand gesturing, doing their hands as though they are talking to someone. Meanwhile, you look and there's nobody. these individuals are running to you, saying they're hiding from someone, they're scared of someone, someone is going to hurt them. You look around, there's nobody in there, nobody after them. Or you see that individuals, you see somebody sitting, staring blankly at one place. You are talking to the person is not minding you, has refused to eat or drink, is just sitting down, just looking at one place. This individual will need an assessment. The earlier, the better for the individual as well. Now, if you also notice that somebody has become socially withdrawn, this is somebody who likes to come and visit the family, comes around, comes out, talk to family and friends. All of a sudden, this person wants to keep to themselves. They want to be alone. They are almost always indoors. They don't go and pray. They don't come out. Even food you have to go and give to them. But previously, that's not how these individuals were. They'll come out, serve their own food. But this time, you have to go in, force them to eat something. If you see that there's decline in your personal hygiene, or someone close to you's personal hygiene, the person doesn't care, looks facial hair, bushy hair, unkempt dress, dirty dress, smelling, this individual may need assessment as soon as possible. Also, there are some subtle changes. You notice that before I could sleep for 6-8 hours. Now I'm not even able to sleep. Even 2 hours, I wake up and I find it difficult falling asleep. I wake up several times. I'm not able to sleep like I used to sleep before, or I am sleeping too much, excessively, and I can't pinpoint what the problem may be. You should come in, would assess you. If you also find out that you've lost appetite, you are not eating well, or you are overeating, you need to come in. And if you realize that there's a drop in functioning, whether at school, whether at work or social activities, you're absenting yourself from work, you realize that your performance at school has worsened, or even at work has worsened, you have difficulties in your relationship with your friends and co-workers, you may need to come in for assessment. Now, individuals who abuse drugs, not just the illicit drugs like cocaine, marijuana, cigarettes, but hospital prescribed drugs, painkillers, you are hooked to it. You have to take it or else you will not be fine, such that you look for money and get that substance at all costs, when even you know that this thing I'm taking may be detrimental to my health, but you cannot control yourself. It's very important that you come in for assessment and help as soon as possible. Now let's look at some of the symptoms in children. The first one would be convulsion. So children that you notice that are having convulsion, okay, it's very important that you seek attention for them as soon as possible. Why am I saying this? I'm saying this because the more these children have seizures that are not controlled, it goes a long way to affect the brain of these children who are developing, and their brains are developing. And this predisposes these children to developing mental health issues later in life, like learning disabilities, and then mental retardation. It's very important that if you have a child who is having convulsion, you take the child to the hospital for assessment as soon as possible and for help to start management for these children. Now, if you notice that you have a child who is delayed in their developmental milestone, so normally 6 months you have a child, the child is not cannot hold or control his neck. You have a 5-year-old is not talking, is not walking. There's a need for these children to be taken to the health facility for assessment as soon as possible. It's very important that these symptoms could predispose these children to having mental health issues, or these could be early signs of mental health issues. Now, if you have a child who has poor academic performance, so maybe this child was doing very well at school, then all of a sudden for some time, for continuously, not just one poor academic performance, but you realize that this has been going on for some time, for some terms now, this child academic performance keeps on dropping and dropping and dropping. there is a need for this child to be assessed as soon as possible. Now, if you have a child who is running around, climbing chairs in classes, fidgeting in classes or at home, fidgeting with their hands and feet, he or she just can't sit at one place. Or you have a child who talks excessively, cannot wait. If you send him or her to go and buy things, he cannot wait for him or her time. You will just go straight to the front. You can't wait. They easily interrupt others, or they blurt out questions when they've not even asked them any question. Or if you have a child who has poor attention, loses items, and they go to school, they are coming home, their shoes are missing, they are wearing socks. You give them stationery, they only come home with erasers, you can't find a pencil, you can't find a sharpener. They are careless with details. When teacher give them things to copy in school, they notice that they leave out some important words in there. All these may be signs. You have to bring the child in for assessment. Now, if you have a child who has difficulties with social relations, now children are social beings and they tend to interact freely with people they really know. Now, if you have a child who doesn't maintain this kind of social relationship, they are always to themselves. They don't play with other children at school or even at home. They tend to want to play on their own. They play with a particular doll. They don't like change. You can't give them something else and they'll be comfortable with it. Okay, they have poor communication skills. They are not able to communicate their needs and all that to you easily. You have a child who has these issues, you have to bring them in for assessment as soon as possible. Now, if you have a child who is cruel to animals, who steals, destroys properties, always running away from school, running away from home, you need to have this child also assessed as soon as possible. It's very important because the early we pick out the signs, the early we can institute interventions that will go a long way to help these children and the family at large. Now, it's normal for individuals who have issues to go to family, friends, religious and community leaders as their first point of call. And so that is why it's important for all of us here to know what mental health is and what the mental health issues are, so that we can help individuals when they come to us, or we can tell that this individual is not well and would need mental health assistance as soon as possible. And so if you notice that someone has a mental health issue, or somebody comes to you telling you about a mental health issue, they need to seek help from a mental health professional from any of the hospital or psychiatric departments or units in the hospital. Now, when you go there, it's a multidisciplinary approach that we give individuals who come to our facilities. Now, you won't be seen by only psychiatrists and medical doctors who are specialized in the field of mental health. You'd also see clinical psychologists who would use the talk therapy, the psychotherapy, to help you with certain issues that you may be facing. We also have the mental health nurses in there. We have the addiction team who help individuals who have addiction problems. Now we have the occupational therapists who will help individuals go back to their daily work activities and all that. We have the social welfare personnel. We have the community psychiatric team who, after individuals come in, would follow up on individuals who have mental health issues to check up on them and see how they are doing in their various communities. And also we have specialist pharmacists in our facilities who help in some of the medication that we may give to particular individuals when they come to the hospital. Now, it's very important for us to seek for help for mental health, as early detection and management will help reduce a lot of stress for the individual and the family would help reduce financial loss, and will prevent symptoms from becoming severe. Now, as I mentioned earlier, when you come to the hospital setting, it's just not medication. You're not taking only medication. There are a lot of things you will benefit from. We'll give you the medication. There'll be psychotherapy by the psychologist, rehabilitation, occupational therapy you would gain. And then there we strengthen the social support. We let family and friends know that it's very important that they are there for these individuals who have this issue. And also to reduce the stigma that is associated with mental health. So we educate the family very well in this regard. We give them family therapy. It's very important. Social support is very important. And Allah has said it in Quran, Surah Al-Baqarah. And a possible translation being, righteousness is not that you turn your faces towards the east or the west, but righteousness is one who believes in Allah, the last day, the angels, the book, and the prophet, and gives wealth in spite of love for it to relative, orphans, the needy, the traveler, those who ask for help, and for freeing slaves. Now, it's very important. Social support is not just social support. It's incumbent on us all to help individuals who need that help in this regard. It's very important. Now, I cannot talk about mental health without talking about Ruqya. And in most of our Muslim communities, mental illness are predominantly associated with jinn. And it's important for us to note that, yes, Ruqya involves the reading of Quran and then prayer for these individuals who have mental health issues. Sometimes the imams also have to beat the spirits out of these individuals who have mental health issues. And so it's very important for us to note that it's not all mental health issues that are as a result of jinn possession. And Muslim physicians, scholars such as Ibn Sina and Abu Bakr Muhammad Zakaria al-Razi have rejected that concept, and they view mental disorder as a medical condition, and so they need to be treated with psychotherapy and drug therapies, as I have mentioned earlier. So it's very important for us to note that aside the Ruqya, there is importance for individuals to seek for help in our health facilities for holistic care. Now, let's look at the role of Islam in the management of psychiatric illness. Now, Allah has stated in the Quran that, and has made it and provided Muslims with a lot of coping mechanisms in the Quran. Now, Allah has said in Quran chapter 17 that, and the direct translation is, we've sent down from the Quran that which is a healing and a mercy to those who believe. It's very important for us to note that the Quran is there to help us cope. And also in Surah Al-Yunus, Allah has stated that, all mankind, there has to come to you instructions from your Lord and healing for what is in the breast, and guidance and mercy for the believers. Through our daily prayers, our supplications, and our zikr, it provides us with constant source of therapeutic relief, and the belief that everything that happens to us is part of Allah's just will and compassion. Also, in the Quran, it has stated that we will be tested, okay? We will test you in fear, in hunger, loss of wealth, health, and fruits, but give glad tidings to patients. Now, one thing that has come to the notice of some of our health professionals is that they tend to realize that when Muslims have these challenging times in their life, they tend to recover faster compared to others. And I think this is what is actually helping us have that kind of upper hand compared to the others, because we have, we believe that we would be tested. And when the tests come, well, glad tidings are given to those who are patient. And so when we are afflicted with issues, it really helps us. Also, Allah has said that if we say Inna lillahi wa inna ilayhi raji'un, okay, any calamity that afflicts us, when we tend to say that, we know that to Allah we belong and to Him is our return. As I said, it's a therapeutic relief for individuals, because they know that Allah is the one that is testing them, and they know that anyone who follows that, okay, has blessings from their Lord and has mercy, and those are the ones that are guided by Allah. Now, in Islam, Allah has also mentioned to us sometimes Islam play an important role in helping Muslims to cope with negative life events, like I mentioned earlier. And one is when we Muslims read the Quran, get to know that we shouldn't despair, that Allah would always provide us with relief. Okay, and always when we find ourselves in hardship, we say, and behold, with every hardship, Allah says to us that with every hardship comes ease. And I think this is one thing too that helps us when we are befuddled, or when we have those negative feelings, we tend to replace them with positive feelings. And these are exactly what actually happens when you come to the health facilities, the talk therapy. They tend to diffuse negative feeling, negative thoughts, and help you replace it with healthy ones. And that is what it's actually in the Quran. And if we are to practice it well, we won't have any issues in that regard. Now, Allah has prevented us from a lot of things. He's made it categorical in the Quran that there are certain things we should not do. And things like drinking alcohol, gambling, unlawful sexual relations, just to mention a few. And if we are to desist from all this, it will go a long way to help our mental health. It's very important. But as sinners, some individual, we are likely, if you ever fall into such practices where you are abusing alcohol or you are addicted to sex, you cannot stop. Allah has said that when you are ready to stop, we should know that Allah forgives all sins, okay? Because sometimes individuals who have this issue may bottle it and think that they are condemned, they may not get any necessary, they can't get any help, and that Allah is angry with them, and so they tend to may even develop more mental health issues. And so it's important for us to let those individuals who have this issue know that Allah forgives all sins, and they can actually go in for the help, and Allah will definitely forgive them their sin. And this helps. This is the positive thing. It helps this individual able to move from that condemned ideology they have, and they will seek for help. And these individuals can become well and live their normal life again. Now let's look at some of the ways or some of the things that prevent individuals from seeking help. And as I mentioned earlier, the first three I've already mentioned it, that a lot of people lack, or they can't tell that these symptoms that this individual is having is a mental health problem. And so they need for them to go for help. Also, we are not aware that the hospital management is Islamic, and so we Muslims can actually go in for assessment and for management without thinking that is un-Islamic. And also the fact that we almost always ascribe all mental illness to gene possession also prevents some individuals from seeking help from the health facility. Now, the other thing is that a lot of people don't know where to seek for help when they have these issues. And I think at the end of the lecture, we'll let you know the facilities that are available that you can actually go and seek for help regards to mental health issue. Also, the stigma associated with mental health issues. So everybody thinks that when I go to mental health facility, they say I'm a mad person. And so people are not willing to come to the mental health institution. Now, mental health is a wide range of symptoms. What I actually said is just a tip of the iceberg. We have a wide range: sleep disorders, sexual disorders. We have, as I mentioned, the children, adolescent psychiatric health. We have a lot. It's a wide range. And so it's not all individuals who would come in with their hearing voice, they're hearing somebody talk to them when nobody is there or behaving unusually. And so there's a need for us to remove the stigma attached to mental health issues. It's very important so that everybody will feel free to seek for help in this facility. Now, sometimes it's as a result of financial difficulties. Some people cannot afford it, so they don't come to our mental health facilities. Also, there's a lack of social support. So sometimes these individuals they themselves cannot appreciate the fact that they are not well, okay? And so it's incumbent upon us to provide the social support for these individuals. So if there's no social support, these individuals don't come in for help and management. Now, some dawa methodologies like the dawa of condemnation is also preventing a lot of people from seeking help. Okay, it's very important for us to let people know that yes, when they falter, Allah forgives, and they can come in for help as soon as possible. So in conclusion, I would want to say that early detection of mental illness is crucial, and there's a need to assess care for better outcome. Now, it's also important for us to encourage our Muslim communities to seek for help from mental health institutions, because the therapeutic techniques that are used there are Islamic. They are not un-Islamic. And also, we have to be steadfast in the deen and follow the guidance of Allah, as it helps us with prevention and healing of mental health issue. We should be advocates for mental health, and we should stop the stigma against individuals who have mental health. Thank you very much. These are my references. I would like to say Jazakumullahu khair. Thank you.
Jazakallah khair, Dr. Niena. That was very, very insightful and instructive. Thank you so much. I think we've all learned a lot about this very deep topic, quite wide-ranging topic. Before we open the floor to questions, people put their questions in the chat. I would like to ask you a question based on your presentation, which I found really interesting, mashallah. And my question is, why do you think that there's been a rise in the mental health illness cases in Ghana and Africa? Why has it risen sharply in the last decade? What do you think the contributing factors are to that?
Okay, thank you very much, Hajia Aziza. Thank you so much. I would like to say that probably because the education is ongoing, and so now people know, or people are becoming aware of the symptoms of mental health issue, and so they tend to come in for mental health management. So I think that is one of the reasons why probably the number is increasing, because now people are actually coming in. And I think also some risk factors may also be the reason why some of these issues, some of these mental health issues are going up, like poverty, okay, some disease outbreaks here and there. wars that are being, or conflicts that are ongoing as well, very important. And also the globalization probably also affecting and help in contribute to the increased burden of mental health issue in our recent times. Thank you.
Thank you so much. Just before we ask some others if they want to ask questions as well. I mean, what advice do you give people if they or their loved ones are suffering from ill mental health? What's the first port of call? If somebody is, in a family, in a house, and they suspect that somebody is suffering from mental health issues, what advice would you give them?
Okay, thank you very much for that as well. I would say we should seek for help in the mental health facilities as soon as possible. It's very, very important that they come in for treatment at these facilities, the psychiatric units and these health facilities. It's very important that they seek for help there. I would say that should be the first point of call. Thank you.
Thank you so much. There's something else that came to mind after listening to your presentation. You described mental health in your presentation as a state of mental well-being. And what struck me is the fact that in reality, no state is permanent. And our mental health, like our physical health, is in a constant state of flux. And what we need to do is actively strive to keep it in balance. You mentioned lots of different factors that we need to keep an eye on to keep it in balance, whether it's sleep deprivation, overworking, all kinds of things. And recognize the signs of where an imbalance exists or an imbalance is developing. Can you speak a little bit to us about the warning signs for mental health? Because it's not something that just affects particular people. It can affect anybody, anytime. And we're all, in a way, dancing around, keeping our mental health in balance. Just maybe some go to one end of the spectrum a bit more and some to another end, but everybody is trying to maintain a balance in their mental health. So can you speak a little bit about warning signs for mental instability? I think you touched on it in your talk, but if you could just reiterate a few of those points, we'd really appreciate it, inshallah.
Okay, thank you very much, Aziza. So as I said, some of the symptoms that we should look out for is that poor sleep, you are not able to sleep well, poor appetite, or either increased appetite, or you are sleeping too much. So a change in your sleeping and eating patterns are some of the signs. Now, changes in your emotions and extreme changes in your emotion. We all are faced with issues that may make us happy or make us sad. But when this sadness is becoming prolonged, you are always feeling sad, you are always things that you used to love doing, you are not doing them, you feel hopeless, you tend to have this guilty feeling about something, all that eating you up, if any social withdrawal here and there, not participating in activities. Also, when we tend to have these thoughts that keeps on recurring in our minds, okay, such that it's so distressing to us, and we tend to kind of have to act on them to have this form of relief. And I think I gave some examples during my presentation. Also, very important and emergency for we health workers is the thought of wanting to harm yourself. If you have the thoughts of wanting to harm yourself or harm somebody else, it keeps on coming. It's very important that you let people know that this is what is happening to you. This is what I'm feeling, so that, and please, if somebody comes to you telling you that I feel like I want to kill myself, I feel like wanting to kill somebody, please, let's not play around it. These individuals may really mean what they are saying. And sometimes it's not they are doing, it's just a mental health issue. Sometimes these individuals too may not just come to you and say that I want to kill themselves. They will start saying that I don't think life is worth living again. I feel like if I had died and gone to meet my parents, it would be good for me. I feel guilty for something of this sort. you see. And then these individuals, if they have children, they have families, start putting down things. They come to you and say, this is my will, or this is my bank account note. You have to be very suspicious of that. We have to really pay attention when our loved ones come in talking to us. Let's give them the hearing they need and listen to them. Some people may really be breaking down with mental health issue. And as I said, I can't still overemphasize the fact that if anybody comes to you telling you that they want to harm themselves or harm someone, treat it as urgent and then seek for help for these individuals as soon as you can. And if possible, if maybe you cannot seek the help there and then, make sure that somebody is close to these individuals who have those thoughts of wanting to harm themselves. Let's make sure that we move things around these individuals that they can use to harm themselves. Somebody should be with them. It's very, very important. Thank you. These are just but a few of some of the symptoms you should watch out for.
Thank you. Dr. Niena. And we have a question in the chat. Doc, please, can you share, for Brother Sherry, Doc, please, can you share some helplines in Ghana? And then below, if you have a PDF of the helplines, can you share it on your screen? Thank you.
Sure, we have a list. I think I'll share them. I'll share them as soon as possible.
In the meantime, should I ask the next question, inshallah?
Sure.
Do you think that the stigma for mental health is reducing in Ghana?
So in my point of view, I think it's not really reducing. Probably maybe it has started, but not to the point where we see change, because this is what actually is happening. Is actually happening. People feel stigmatized. People will still come and tell you the reason why they are not coming is because of this. People will say they are mad. That is why they don't come to the mental health facility. And I think the stigma is still there. And that is why we are raising this awareness, so that everybody knows that mental health issues are just like medical problems or medical issues like hypertension, diabetes, okay? And it can happen to anybody. And so let us treat it as such. And if you notice that somebody has it, don't stigmatize, rather help the individual get the necessary help that they need. And it's very important. You may not know, maybe next time it is you. And so let's try and make sure that we give the necessary help. We tend to be mental health advocates. It will go a long way to really help. Thank you.
The next question we have is, are there any cultural or societal factors that can influence mental health within the Muslim community? How can we address these factors to create a more supportive environment? So I think the question is, maybe, are there any social or cultural factors that can influence mental health? I'm wondering, you mean negatively? So cause mental health breakdown? Is that what you mean, Brother Sherif, within the Muslim community? And if so, how can we address these factors? I think, is there any cultural or societal factors that can actually affect people's mental health? Yes, that's what you mean. It's confirmed, alhamdulillah. So yeah, so cultural or societal factors that can negatively influence mental health in Muslim communities. Now, how can we address these factors to create a more supportive environment? Just a very good question, mashallah, Brother Sherif. Thank you so much for that input. Dr. Niena, what would your response to that be? She's on mute.
Naam, Assalamu alaikum.
Yes.
So, okay, so as I mentioned earlier, I think I mentioned one very important point in the presentation, and I think that's more of a religious factor. So some societal or cultural factors is where we sometimes find ourselves in certain communities where we tend to think that certain practices are normal, such as indulging in substance abuse, and all that. A child growing in a community where they are exposed to these things tend to think that these practices are normal and these are contributing factors. Okay. When people are forced into marriages and all that, those are also practices that could affect the well-being of the individual that is being forced into such marriages. It's very important that we note all those things.
Yeah, some of these social cultural practices that put a lot of strain
on
the individual
yes,
are not really rooted in Islam.
Yes.
And then you know this is, and the society just doesn't question it and just accepts it, but it's maybe the society is culturally Islamic, but they're not looking at really, is this really Islamic, you know? Putting people in a situation, maybe, you know, even things like the marriage and everything, all the expense that's incurred, that's not unnecessary, and maybe people can't afford it, you know, all those kinds of things that makes people start feeling under too much pressure, you know? I mean, quite often it's, even if it's social or cultural, quite often it's just the social pressure of doing things that are not really in line with your authentic self. You know what I mean? Or things that are not really in line with your own personal well-being, but society feels that you should do them for no really justifiable reason other than it's a tradition of the culture, or people will look at you strangely if you don't do it. I think those kinds of things can really affect people's mental health.
Very, very true. Very true.
And I think
one.
Go on, Dr. Niena.
Pardon?
Please go on. Please go on.
I just wanted to say that one thing I've also noticed is that our mothers in marriages in our country, sometimes they are overburdened and with house chores, with responsibilities, and sometimes the men don't actually go in there to help them, as sometimes it's a taboo to actually go and say, in our context, if you finish eating, the man comes to say he's coming to help you wash the dishes or help cook today and all that, come and pound fufu with your wife. Some of our practices kind of frown against that. And so there's so much pressure on these mothers. And even when they are pregnant, they still are expected to do all these things. As I mentioned, stressful events during pregnancy can also predispose the children, not only the mothers, the children also to mental health issues. So it's very important that, yes, there are some responsibilities that are portioned for men and women in marriages and all that, but we have to help each other. And the Prophet, peace be upon him, used to help his wives. And so we have to inculcate that and help these women. And that is one thing that I've also noticed that goes a long way to affect our mothers in our community.
Because there's two jobs. I mean, being a housewife, and look, it's a full-time job that doesn't really, you don't really have the coffee breaks, the lunch breaks, or the, do you know what I mean? So that is already a full-time job. And then a lot of women these days, they have that full-time job and then have another layer of professional work, or, you know, earning or trading, whatever. They have another income generating work. And so it's just, they have double, but they're still expected to do all the house chores and look after the kids and, you know, be there for the in-laws and be there for extended family. They're still expected to do all of those things. So it's a lot of strain. And also a lot of men have a lot of strain if they're, you know, they're working and then they're expected to do a lot of other things around it. So people need to keep an eye, and people just need to support each other, you know? And I think also we need to kind of really promote the African village mentality, where people are really supporting each other. It's not just nuclear families, where it's, you know, the extended family is also being supportive, you know, and supported, not to lose that, because gradually societies with urbanization are becoming, families becoming more and more nuclear, and then you don't have the support required, you know. We have some more questions, and let's just take them as they've come in. So another question is, are there any specific Islamic practices or rituals that can contribute to mental well-being? How can we incorporate them into our daily lives?
So, as I earlier mentioned, all the guidance we need is in the Quran and following of the hadiths of the Prophet, peace be upon him. So our 5 daily prayers, your zikr, your zakat, your fasting, all these activities. And if you are true to yourself, if you are doing it, you tend to have this kind of well-being. If early in the morning before you go to work, you do your askar before you leave home, you have this form of well-being, you have this form of energy that whatever you're going to do, you have Allah by your side. And so when you even go out there and you are faced with challenges, the mentality with which you go about how to solve these issues is way different from if you hadn't even done that. And so these are just but a few. And if you go through the Quran and Hadith, there are a lot of there are a lot of practices that you could do that will go a long way. To help your mental health, the fasting, the zakat, all that is very important. And if you are doing it and doing it well, you realize that your mental health, you probably may not have mental health because you have good coping mechanisms. And these are some of it that I have mentioned, but it's not exhaustive actually. No, thank you.
Yes, I think thank you so much. I think it's also, with the Quran, it's through the dhikr of Allah that one finds peace. The peace is also, it's kind of holistic, you know what I mean? How the dhikr and the salat and all the other things, they give one a sense of peace and well-being and a protectiveness, and also a sense that, this is because it's the stresses of life that can cause that pressure to break down. Because with mental health issues, it's kind of a breakdown of being able to cope, because the challenges are always there. Does that make sense? In the same way that you always have, viruses and bacteria, but your immune system is working well. It's the same with your mental health. There's always this kind of barrier. But if it kind of breaks down, then one can't cope anymore. So I think, as Dr. Niena was saying, all these practices, they help us to keep our spiritual immunity up, and also keep perspective. Say, look, the dunya is always going to be a struggle. It's not the be all and end all, and Allah is there for us, and having faith and not being overwhelmed by, the dunya. So it helps a long way. But let me go to the next question. Thank you so much for that, Dr. Niena. I said, please, what about one's inability to focus or think properly? Can it be considered a mental health issue? So someone is saying, what the ability to focus or think properly, can it be a mental health issue?
Thank you very much, Hajia. It's one of the symptoms. Yes, it can be a mental health issues, poor concentration. So the need, if you, have that happening to you most of the time, you may need to come in for assessment. Sometimes it may be as a result of other medical conditions. But if you notice that you are having this symptom, this is just one symptom. So when you come in, we may probe further and see what probably may be the cause of your poor concentration. But yes, it is a symptom, and you may need to come in for us to do more assessment and see what the issue may be. Then we help you accordingly.
Thank you so much for that. The next message is, Dr. Niena, please, how do you prioritize self-care and maintain your own well-being while working in the field of mental health?
Please, can you repeat the question again?
Yeah, the question is, how do you prioritize self-care and maintain your own well-being while working in the field of mental health? So for those mental health practitioners who are day in, day out dealing with people's problems and mental health issues, it must be a strain, because dealing with one's own mental health issues is a strain, let alone dealing with various clients and people coming in to the practice every day. So how do you prioritize self-care and maintaining your own well-being whilst working in the field of mental health?
Okay, thank you very much, Hajia. Now, for we, the mental health professional, yes, it's very important for us to keep our self-care. Now, remember that for us to be able to help those who actually need help, we ourselves have to have a good mental health. And just like Allah has said that if you want something good for someone, you also have to have that as well. And so it's very important for us. And sometimes what I think I do that helps me with my mental health is that when I get to the point that I know that I am getting burnt out, I take some time off, or I actually refer to another colleague who can help me in that. I mean, refer the client to another colleague who can help me in that regard. And also, as I said, adding my Islamic practices, I've realized that the more I do my zikr, the more I'm able to perform my 5 daily prayers, okay, my fasting and all that. It all goes a long way to help me in my coping mechanisms. I make sure that I have balanced meal, just like the things that I mentioned earlier. Those are the things that I do daily that helps me in my daily practice. And the most important thing is for me to know when I need a break. Is very important for me. Or if I'm becoming overwhelmed, I know when I have to take that break or seek for help as well. So, and I think the other thing is the social support I also get from my family as a whole also goes a long way to really help me. And I can't overemphasize. That's why I kept on emphasizing on the social support. Is very, very important in our families. The social support is very important. And I think that is what is also helping me with my mental health, whilst I help individuals who have issues in that regard as well. Thank you.
Jazakallah khair. So what I've done is I've just posted a document that was created by Dr. Niena of a list of private healthcare facilities that provide private mental health services in Ghana. So please feel free to click on that, upload it and, use and, file it and use it. I think that the next question is if there's a history of mental health in a family, what is the probability of another member of the family experiencing it?
Okay, so the probability differs with the various mental health issues. So what's very important is that if you have a family...
Can you raise your voice a bit, because somebody just said the voice is a bit low. Okay.
Oh, sorry.
The question
so
is,
I'm saying,
if someone has mental health in the family, what is the likelihood, the history of mental health in the family? What is the probability of another member of the family experiencing it? That was the question. Thank you.
Okay, thank you for the question. And what I was saying is that the probability that you would get a mental health problem depends on the type of mental problem or the diagnosis that this individual has. And so it is not maybe 10% for all the sickness. All the various psychiatric illness have their own probability of you getting it. But the most important thing is that if you have a member in the family who has a mental health issue, then you know that you also stand a risk of developing it. And so what do? You make sure that you have good coping mechanisms. When you start picking up signs of certain things about yourself, you seek for help as soon as possible, so that if you are also developing that mental health issue, you can be assessed, it will be picked up early, and an early intervention is instituted for you. And so it's very important in that regard. Thank you.
I mean, Dr. Niena, I'm just thinking that it may not be so, it's very important to actually acknowledge, analyze, diagnose, but it's not very different from having a history, for instance, of high blood pressure. I
Is
suppose,
the
in the
same,
family, where
basically.
you know,
Yeah,
okay, everybody in my family post 40 got it or whatever, you know, whether it's diabetes, high blood pressure, or whatever, you know. And then you think, let me make sure I watch my diet, or let me exercise, or let me
exactly.
get enough sleep and not
Exactly.
overwork, or because it's a tendency in my family, you know.
It's very true.
And so I'm wondering if there is that much difference, because both of them, if you don't control them, affect your ability to function. Because
Yes.
someone could say, oh, mental
Yeah.
health is a bit different because it affects your ability to socialize. But even if your high blood pressure gets too high, you're also going to be affected. Diabetes the same. I mean,
Yeah.
kidney and liver failure the
Yes.
same thing. So
It's true.
people need to get
It's
rid of the
true.
stigma. It's the same as saying everybody in my family has diabetes. Everybody has this one. Everyone gets
Yeah.
knee ache after a certain age. So let me make sure I'm eating all the right foods and not straining myself. It's just being accepting the reality, analyzing it, and then finding out what you can do to mitigate and improve, and then communicating openly with people. You know, that this is an issue. So I think should be no shyness or shame. You see, I think we are human beings. We have physical, mental, spiritual with weaknesses and imbalances sometimes, and I think the only way to address it and catch it early is to acknowledge it and to with people who are able to help you to be very candid about it and consult with those who are able to help you, and
Yes.
identifying those people. I think that's the issue where people find it hard to identify the people that they can go to and talk to about it,
No,
Um,
no.
yeah.
Very
I mean,
important.
in a lot in the Western countries now, I mean, a lot of offices and institutions have psychiatrists and psychologists there because they recognize mental health. The same way they have a nurse that deals with first aid or sudden illness or somebody who just faints. They also have the psychologist to do and help deal with people's mental health. It's just acknowledged as people just need it sometimes. People get burnt out. People have a bad chapter in their lives and they're not coping well. It's kind of very accepted and very scientifically accepted. Not like this person can't cope, but just like okay, this person has. We all catch the flu sometimes, or we all are low on energy sometimes. It's very matter of fact now, you know, which
No,
I
no.
think is where we need to get to a bit more in maybe in some of our Muslim communities in West Africa. What do you think, Dr. Niena?
Aja,
Mhm.
please, your last statement.
Yeah, I think we
Sorry.
need to get to a stage where it becomes a matter of fact issue, because I was saying
Yeah.
that in a lot of Western institutions or offices, they as well as having a nurse that deals with somebody's first aid issue or someone fell sick at work, they have to go to first, the
Yes.
nurse. They also have a psychologist or there to deal with people's, issues if they're
Very
burnt out.
important.
It's like, okay,
Yeah.
the person is burnt out, the
Very.
person has gone through a divorce, or the person, they had a tragedy in the family and they're just finding it mentally difficult to cope. Or there's a family history and
Yeah.
there's someone to talk to there who can refer them to a specialist and help them deal with it.
It's very
And it's
important.
quite matter of fact. It's not like, that's a big drama. It's just like, no, these things happen. Um, yeah.
No, it's very important.
I'll just, before we
Very.
start to round up, I think I'll just try and answer some of the other questions. We've got some very good questions here, mashallah. Thank you so much for everyone posting your really insightful questions. So I've done the history one. So next question is, what role do you believe mental health education should play in schools, workplaces, and society as a whole? How can we work towards creating more mentally healthy environments?
Okay. Thank you very much for the question. I think it's very important that we start the education, like you said, in schools, in workplace, in society, so that people, number one, know what mental health is, know that mental health issues can affect anybody, where they can seek help, being able to identify the issues of mental health is very, very important that we go out there and preach this to everybody. And I think this is the reason why we have started this, and inshallah will continue. ISIP would continue in this regard to sensitize and let people know what mental health is all about.
Thank you so much.
And also in our facilities, like you said, the school, the workplaces, we also have to make it a bit conducive, okay, such that it's easy for people to come out and say what their problems are. or just like how someone can easily come out and say, I'm having headache, I'm having chills and all that, and we say it's malaria. It should be so easy such that even our children can come up to us and say, Mommy, this is what I am, this is my problem. Or a worker can easily come to their boss and tell them that this is what I am going through. And there should be, they should be helped in that regard. Okay, it's very, very important. Education cannot be overemphasized. And this will go a long way to take care of the stigma that we see nowadays. Very important. Thank you.
Thank you, Dr. In terms of the practical steps towards this education, would you suggest, like, because I mean, a lot of private schools now have the budget to be able to have in primary level, a mental health specialist or a psychologist or psychiatrist, but a lot of public schools don't have the funding for that. And so in that case, what would be, they would probably rely on the NGO sector to be doing, workshops, sometimes time and hours workshop for the school, where they have a Q&A on mental health. You know what I mean? Because they don't have the funds to actually, they're already struggling to pay teachers, let alone, what would you say to that?
It's actually a struggle, and it's very true. And because of lack of funding, a lot of these things cannot be done. But the other thing is that we have to also empower the teachers so that they can pick up science as soon as possible, just like I said. If we can't provide them with the professionals in there, we can teach them to identify these things amongst children or even your co-worker. And even to the working community or to the workplace, they have to get this psychologist or in the workplace to help, psychiatrists to help. And also they should have workshops for their workers so that they will deal with some of these mental health issues and advise and let people know what they can do in the early stages to help curb it from becoming a very severe or serious one. Yes, it's mental health. We don't have a lot of fundings, and that's why we are advocating for everybody to come on board, not just the education, but if there are bigger NGOs out there who can come in and support in any way, where we can do health screening, mental health screening for schools or communities and all that education, it will go a long way to really help a lot.
Okay, Niena, one last question. Thank you so much for your time. We're just coming up to our wrap-up time, inshallah. The last question is, are there any emerging trends or advancements in mental health research or treatment that you find particularly promising or exciting? Dr. Niena?
Now,
yeah.
You were saying?
The question is, the last question is, are there any emerging trends or advancements in mental health research or treatment that you find particularly promising or exciting?
Okay. Ajay, thank you very much. To be frank with you, research in mental health is not as much, I would say. Research in the field is now growing actually, and right now what is trending is the fact that we try to tailor the treatment to individuals. So yes, you may give this medication to this person, you may not give it to another person because of probably some features that these individuals or some characteristics that this individual may have. The other thing is that psychiatry, as I said, the research is in its infancy in the country, and would advocate that anyone who is willing to invest in that would really go a long way to help. Another thing is that currently we are tending to look at more objective ways of diagnosing certain conditions, and that one too is still in its infancy. And so more of our diagnosis and all that is more of a bit subjective. We are looking at objective ways in identifying individuals who may have psychiatric illness. Just like maybe if I do RDT test, I can pick up malaria. We are looking at more objective ways that we can, pick up these diagnoses. And I think that's what I would like to talk about in this regard now.
Inshallah. Dr. Niena, thank you so much. And, this has been really insightful and interesting. And I think there's a lot to talk about on this issue. And inshallah, we are just starting. A lot of our participants are saying, Jazakallah khairan, thank you so much. A lot of positive comments, saying, that this has been a really insightful course. We're indeed learning. We need more of this, inshallah. And Jazakallah khair, this intellectually stimulating short course. So I think we are alhamdulillah, inshallah, we're starting to address this issue in Ghana. It's been addressed already, but maybe, this kind of forum where we've got ISIP Ghana, having people who are interested in this subject coming together to discuss it and to see how we can move the trajectory forward in a positive way. Please stay in touch with the ISIP YouTube channel. And, I think Brother Sheriff has posted all the links. So please take the time now, a couple of minutes now, to join all the links. If you go up the chat, you see that Brother Sheriff has posted various links. His recordings of this and previous sessions is available on the YouTube channel. But this one will be posted in due course, but there's lots of other sessions that you can listen to on the issue of Islamic psychology on the YouTube channel. So please, that's the YouTube channel link there. And then join our Islamic Psychology WhatsApp group, a team where people share resources and announcements of events. You can join the WhatsApp group, so please click and join. Please feel free to join our ISIP West Africa WhatsApp groups to benefit from initiatives. And also join our ISIP Ghana Islamic Psychology WhatsApp group where resources and announcements are also shared. There's an Instagram channel for those who are active on Instagram. And there's also a website where you can, start to get a broader idea of what ISIP is doing and what they're up to. And, if there's any topics or things that you feel you'd like to have addressed specifically by ISIP Ghana, maybe just send them a WhatsApp to the ISIP Ghana group on WhatsApp and say, look, can we address this? Can we address that issue? And, the team, the task force in Ghana will try and, get the relevant specialists in the field to address the issue, because really it's the people out there know what is happening. And so we really need to have our pulse on the ground and address the issues that they want us to address, because it's the people on the ground that know what is going on. So thank you so much. It's been very, very engaging and stimulating. Dr. Niena, thank you so much for your time and your input and your hard work, and all the audience members. Really, it's Saturday afternoon. I know people are so busy normally in Ghana and Accra on a Saturday afternoon, but a lot of people logged in, I'm sure, from Ghana and outside of Ghana. And we really appreciate your time and efforts, and we pray that Allah facilitates things for all of us. Dr. Niena, please, maybe you can close with a dua for us, inshallah. Dr. Niena? Yes.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Jazakallah khair. Thank you so much, everyone. Inshallah. We'll see you soon, inshallah. Assalamu alaikum.